You can feel the difference?
Yes. Oh, that's good. Babe, you got to learn this one. This is helpful? Yes. This is going to be super helpful.
Paula Nkaya Mabunzo is getting ready to welcome twin daughters into the world. This is her third pregnancy, but the first time she's used a doula.
Working with a doula gives me peace of mind that I am aware of my different options, that I'm going into this process educated, and that there will be somebody there to advocate for me and just offer me that emotional support that I'll need through this very intense time of delivering my daughters.
That's an exercise that you can do to help get your pelvic muscles loose.
Lee Walker is the mother of 2 children and has been a certified doula for 3 years. But she was inspired to help women become mothers, including busy working moms like Paula, for much longer.
I kept asking over and over, could I come into the delivery room? And people thought I was really weird, but I would still be there cooking, helping with breastfeeding, all of the things that doulas do. I just didn't know that it had a word for it and that I could actually do it as a profession. You get one side, I get one side, and we jiggle the apple tree.
Okay.
Yeah. This is my calling, and I know that this is what I'm supposed to do.
She became known in the doula world as Mama Lee. She now works as a doula through the Sankofa Birthworkers Collective and has assisted more than 40 women before, during, and after they've given birth. The Sankofa Doula training program consists of understanding the physical aspects of labor and birth, providing comfort and support in a home or hospital birth setting, and facilitating communication between mothers and medical staff.
The baby actually takes quite the journey. The baby has to descend into the pelvis sideways, and then the baby will turn because the smallest part of the head right here will actually help to open the way.
After having a doula for the birth of one of her 3 children, Deirdre Medley became one herself. 13 years later, she teamed up with other birth workers to create Sankofa in 2018.
We wanted to first create a space for those who provide prenatal, labor and birth, and postpartum support for Black families across the Inland Empire as providers. And we want to ensure that there were other culturally congruent and racially concordant providers that would provide safe spaces and safe care and support for other Black families here in the region. But if this can be relaxed and release the muscles and the tendons can also be relaxed, then that pelvis can open a little bit more too. And also we're bringing comfort to the birthing person.
Sankofa is a collaboration of a variety of different types of health professionals that provide services, support, and education that foster wellness in Black birthing families.
Not just doulas and midwives, but we have doctors and nurses, mental health professionals, movement specialists, lactation specialists, physical therapists, anybody who wants to work with, support, and take a stand to improve Black birth. This is what Sankofa is.
Studies have shown that Black maternal and infant health disparities are symptoms of broader underlying social and economic inequities that are rooted in racism and discrimination.
Black women across the nation are now 3 to 4 times more likely to die during the end of pregnancy, labor and birth, and in the early postpartum period. These numbers are also reflected in infants, where Black infants are also more likely to die, twice as likely to die as their white counterparts. This is because of systemic racism that pervades the medical industrial complex. And for me, the simplest solution is stopping and listening to those patients when they express concerns. 80% of those maternal deaths are actually preventable.
Sankofa receives funding to provide services to Black families in San Bernardino and Riverside County by a number of local, county, and state programs. Services provided by Sankofa are free to families and is not income or insurance-based. The only qualifications are that the birthing person needs to identify as Black, African American, or of African descent, and they must live in Riverside or San Bernardino counties.
This really does help. I don't know why it took me so long to get to this point.
Lee says each family needs something different, but in addition to supporting the mothers, she also makes sure to include family and friends in the process whenever possible. In Paula's case, her husband Lionel is learning his part.
She'll tell you, like, I feel like I need you to do the hip squeezes. It is the honor of my life to be able to be invited into such intimate, vulnerable spaces with these moms. The look that a mom gives me, and she has absolute terror in her eyes, and when she can look in my eyes and I can just tell her, you're okay, you're gonna be okay, and I see all of that tension relax out of their bodies, I get so much fulfillment out of that, and I will be doing this until the day that I die.